PPE, personal protective equipment, those masks, respirators, gowns and gloves, so critical in protecting NHS staff and patients from Covid-19. We already know of the dire shortages as the pandemic swept the nation, the desperate global search to replenish that stockpile. But what we can now report is that despite repeated assurances from the highest levels, the PPE that was stored in this warehouse in case of a pandemic was not properly tested. We have learned that 85 million masks and respirators, some of which have already been used, have now been withdrawn, disposed of, or had safety warnings issued. The UK had built up a £500 million stockpile of emergency PPE to use in a pandemic. But as we reported in May, the stockpile had been neglected. When the virus hit, almost half of that stock had expired. The government sent them out anyway. The Health Secretary, Matt Hancock, even helped distribute them. But was it safe? After our last report in May, the Department of Health and Social Care told us every single piece of PPE deployed to the front line from the stockpile was rigorously tested and met the high standards required. So we asked, as you would expect, how was it tested and what were the results? It has taken us nearly 6 weeks to get those test results from Public Health England, who were responsible for them. And this is what it has to say. Of the 16 million expired 3M respirators, only a sample of 49 were in fact tested for penetration of filter material and for breathing resistance. They all passed their test, but that sample size meant, the report says, the testing requested was insufficient to verify compliance with the clause. Inspect told us the testing was carried out as per the government's instructions.
The amount of testing that was done was really woefully inadequate. I would have expected perhaps 10 times as many tests as were carried out, to be sure, and that those tests should have been carried out in clearly in a representative way from the stockpile. I can't see any strong evidence to suggest that the masks that were released were not suitable to protect individuals. And that's not really what I'm trying to say. What I'm trying to say is that the process that went through was not really sufficient to be sure of that.
The government gave reassurance that all equipment has been tested and is safe, and the expired 3M masks were distributed across the health service. In early May, though, problems began to be reported. This is what we have established. There were 67 million cardinal surgical masks in the stockpile. All those remaining are now being withdrawn. Safety warnings have been issued for 3M respirators. There were 11.5 million of those. And cardinal respirators are no longer being distributed. We don't know how many of the nearly 7 million had been released for use. That's more than 85 million masks and respirators in the stockpile, all affected in some way. We have also seen a confidential memo sent out to NHS staff, and it is referring to these 3M masks. It says in some cases the grey noseband is missing, in other cases that noseband is degraded, that it's dry and crumbly. These cannot be used, the memo says. They are suboptimal. And on the 26th of June, a notice went out about the cardinal masks, recommending that all lots of this product are disposed of locally. There is a risk to staff wearing the mask if the foam strip on the mask flakes and enters their airway or mouth, it says. In response to the small sample tested, Public Health England told us,
the Health and Safety Executive agreed to a limited testing process. The report shows a 100% pass rate, which provided full assurance on their safety.
The Department of Health and Social Care said,
the quality of PPE released to the front line is critically important to us. Rigorous checks were made to ensure products were safe before being distributed to the front line, and all products purchased for the stockpile in 2009 met the essential safety requirements required by law. As soon as we are alerted to any potential issues, we take immediate action to ensure the safety of our health and care staff and work to resolve those issues as quickly as possible.
In times of crisis, in the midst of a pandemic, safety is paramount for those who do the caring and for those who are the patients. But now we ask, was our PPE safe enough?
Well, we did ask for an interview with the Department of Health, but they declined. I'm joined now by Rachel Reeves, the Shadow Minister for the Cabinet Office, who has been dealing with the PPE issue for the Labour Party. The implications of these revelations are potentially very worrying indeed for NHS staff who've been using this equipment.
Well, I know that many people who work on the front line have been desperately worried through the course of this pandemic. First of all, about whether they would be able to access the correct PPE. And now, because they're learning that they may have accessed PPE that wasn't of the quality or standard that they were assured it was. And the government must apologise to those who work on the front line, but also learn lessons, because we see in Leicester a second spike in the virus, other parts of the country on alert because of high rates of infection. And the government need to learn lessons to ensure that nobody else is issued with PPE that isn't safe, that could potentially be dangerous, because we ask people to go out and serve on the front line to keep us all safe. And it's the very least that we can do to ensure that they are not put in harm's way in doing their job.
But it seems almost impossible to hold the government to account on any of these things at the moment. Every time the question of learning lessons is raised, they say, yes, we will learn the lessons, but now's not the time.
Well, this is absolutely the time, because this virus is not going away. We'll see, as I said, in Leicester, another lockdown having to be imposed, a risk of that happening in other parts of the country. In other parts of the world, we're already beginning to see a second wave of the virus beginning to spread. And we need to ensure that we're learning the lessons of what happened in February and March, where we were too slow to lock down, too slow to get the PPE to those on the front line, too slow to put that arm around our care sector. Learn the lesson now so we don't repeat the mistakes if a second wave was to occur here in the autumn. And it's not good enough to say, we'll learn the lessons for some future date. That future date could be very soon, and it's essential that those lessons are learned to protect us, to save lives for a second wave.
But do you have confidence right now in the stocks of PPE being given to NHS staff who are still facing highly contagious patients?
Look, I'm hugely concerned about the circumstances in which we're asking people to go out and serve in the front line, particularly those people who work in care homes, who have struggled right from the beginning and right through this crisis to access both the PPE and also the testing that they need. And it's both of those things that are needed to reassure people on the front line that they are supported and safe in the jobs that they do. And it's not good enough for the government to say that everything that went into the pandemic stockpile in 2009 was safe. The pandemic occurred 11 years after that. And what was safe in 2009 and what was safe for a pandemic that they were preparing for then was not safe, it turned out, in 2020. And it's not good enough to say that checks are done. The checks were clearly inadequate. It took work of Channel 4 News and others to reveal the full extent of the problems. And it shouldn't take investigative journalism, as good as important as that is, to get to the bottom of this crisis and get answers for those who serve on the front line. And I just say this again because it is so important. Those who put their lives on the line to care for others should be given our full support and full protection. And they should also get answers, not a shoddy government who won't take responsibility for the situation we find ourselves in today.